Louis Mendez. We also have Mr. Dr. Arif, who's APPNA's president. We have Brother Arshad Jamal, ICNA Northeast Director. Assalamu alaikum, guys. How you guys doing today?
Walaikum
Walaikum
assalam.
assalam.
Thank you very much. We are doing good.
Thank you guys so much for
Salam, Kevin.
joining. We have a huge community announcements that we want to spread to our viewers across the U.S. and across the world. So we want to start with Brother Arshad Jamal. Brother Arshad, you're from ICNA Relief. What's going on? What are you guys doing on the ground?
Yes, sir. So we are in ICNA Relief, especially we are in 26 offices around the country. It's a national organization. We do relief work only in this country, United States of America. And we are on different things. We are hospitals, we are doctors on board, we are food distribution, hunger prevention, we have back to school we do, and we do, I mean, in different angles we are doing a lot of things. We have women shelters and family shelters, a lot of things we are doing. But especially in this crisis, what we are going on now, we are basically on hunger prevention, because people, they are laid off from their work. They're sitting home. Especially those who are taxi drivers, the Uber drivers, small works. They are not going home, and they are running short of groceries, short of food. They cut most of the restaurants, they are closed. So what we are doing now at this time, we are basically in food distribution to our first responder also. We have a partnership with APPNA, this Pakistani physicians, especially I'm talking about now New York, because I'm sitting in New York. It's happening around the country, but I'm just talking and focusing our work in New York. So we are distributing food to first responders, to police stations, to doctors, those who are working 24/7. We are going door to door. We are doing home delivery. We are partnership with Halal Guide. We are running a 2K food boxes. 2,000 food boxes. We're gonna distribute. People, they can come. We have a specific gave a few restaurants name, and people, they are coming every day and picking free food from there. We are partnership Muslim Cares. They are also distributing food and talking to some restaurants, and we are distributing lunch boxes and dinner boxes. We are partnership with Latino Muslims of New York, Sister Tusha in Bronx. She is working with us, and she's also distributing for food in Bronx area. So basically in New York, we are in all the boroughs, and we are trying our best. This is one part. The other part is a partnership with Dr. Arif, this APPNA, all Pakistani physicians of North America, and we are working on telemedicine and telecounseling, which Dr. Arif can put some shadow on this one, inshallah.
By the
So,
way,
assalamu
what a
alaikum.
great, let me just
Go
say
ahead,
this.
please.
What a great presentation of the work that you're doing. God is with you. And I am sure that this takes a tremendous effort. And on behalf of all the Latinos who are listening to us on El Villano Radio, I want to say to you, muchas gracias. Señores, señores, estamos acá con, and I'm going to translate a little bit. Estamos acá conversando con todos ustedes. Mi nombre es Luis Méndez del Villano Radio y de America's Islamic Radio, junto a Kevin Shaquille y dos personas muy especiales invitadas para un anuncio muy importante en la comunidad. So, bienvenidos and thank you so much. Next.
So, assalamu alaikum. My name is Dr. Arif Ibrahim. I'm the president of New York APPNA chapter. APPNA is actually a representative organization for Association of Pakistani Physicians in North America. So our organization is actually working and doing all these charity work nationwide. So we have a central APPNA. There is actually, doing all these charity work like, free mobile clinics. They usually actually go and support people during the disaster, like, the earthquake or flooding or, and there is a long history, working with all these organizations. But ICNA is actually our main partner. So again, we work actually ICNA at
ICNA
every
Relief.
level, at the central level, at the chapter level. So there is a central APPNA, and then each chapter is actually in all these states, like New York. So I'm actually the president of the New York chapter. So as Brother Jamal just mentioned, that we are doing several things with ICNA, because ICNA is actually a nationwide organization. They have the expertise, they have the infrastructure, they have the experts in IT department, in promotion marketing department. So we thought that whatever we do, it should actually go as long as actually we can reach out. And this is what actually we are doing. So we are doing a couple of things with ICNA. Number one is the brother Jamal actually explained that we are setting up a hotline with the help of our physicians, and some of them are actually bilingual, who can speak English and Spanish fluently. So this will be a good assets for us and for you guys. So we wanted to welcome our Spanish brothers and sisters. That if you have, we are actually obviously undergoing a very serious crisis, and this is a health crisis, and people are actually worried about their health and their life. So they have a lot of actually medical questions, and they wanted to find out somebody who are expert in this field. So we are very happy and very humble that we can provide this service to provide some comfort, to provide them some expert opinion about how this disease is actually working, how we can prevent it, and what should we do in this crisis. In addition to
Okay.
that, actually planning.
If I can interrupt you a
Sure.
little bit, so that is where I can catch up and translate to those folks. We got a lot of people listening to us. Damas y caballeros, bienvenidos una vez más. Mi nombre es Luis Méndez del Villano Radio, junto a mi socio Kevin Shaquille, que se encuentra en casa. Kevin, I hope you're doing much better today. Señoras y señores, tenemos acá a dos invitados especiales. Tenemos al representante de la asociación ICNA y el representante de la asociación APPNA, que quiere decir Asociación de Doctores Pakistaní en los Estados Unidos. Ellos y nosotros de El Villano Radio y American Islamic Radio tenemos la oportunidad de trabajar ahora a favor de la comunidad en un anuncio muy grande. El doctor estaba comentando, para las personas que no comprenden inglés mucho, hemos hecho un trato con ellos. Ellos tienen una línea telefónica donde le da acceso a doctores que hablan completamente bien el lenguaje español e inglés, obviamente, para que así ustedes, los que están en casa, los que tienen miedo, los que tienen el temor, puedan comunicarse completamente gratis. Esa es la primera parte. La segunda parte es cuando ya pasan el proceso, lo que se llama screening, ustedes van a tener la oportunidad, si están con los síntomas del coronavirus, y ya el doctor nos va a explicar cuáles son esos síntomas, que vamos a pasar a la segunda etapa, que es que un doctor te va a llamar si tú llenas los requisitos del coronavirus, esos 3 que va a explicar el doctor, y después de eso el doctor te va a hacer un asesoramiento por teléfono para después poder recomendarte las acciones médicas que necesitas, incluyendo poder darte una prescripción si así es necesario. Así es que comenzamos esta conversación. Es importantísimo esto, ya que nosotros hemos estado trabajando en esto y tenemos el apoyo de APPNA y de ICNA, que son organizaciones nacionales de doctores de origen pakistaní y de origen musulmán, que ahora se unen a esta causa que nosotros les hemos pedido que vengan a ayudar a nuestra gente aquí en Long Island. So I just explained and I caught up with everything that you've said. And one of the things, doctor, that is important is before we give them the phone number and anything of that sort, you're a doctor. And I would like to hear from you on what you are seeing in the front lines. What are the classic symptoms of the coronavirus? Because there's a lot of myths out there, right? And what is the process by which we don't put an overwhelming pressure on the hospital system? Because then that means that healthcare workers are going to be making decisions that we don't want to put them in. And then on the other side of the coin is, how do we keep those who are at home, who are concerned, who are afraid, who are praying to God that they don't have the disease? How do we keep them sane? How do we keep them emotionally stable so that they realize that what they have is not coronavirus? Because right now is flu season, is allergy season, and a lot of those things are the same symptoms as the coronavirus at the beginning, or just people's fears. So, damas y caballeros, le acabo de preguntar al doctor que nos haga un assessment de lo que es los principios del coronavirus, lo que es los mitos y las realidades. So go ahead, doctor.
So just wanted to make sure that everyone understand how we can actually differentiate COVID-19, which is the corona-related disease. How can we differentiate from the other cold symptoms, like the common cold or flu, or sometimes people usually get just headache or body ache. So there are 3 major symptoms that actually direct somebody towards COVID-19. Number 1 is dry cough. So we have several types of actually, people usually get several types of cough. Sometimes, most of the time, when you are actually having common cold or flu, your cough will be productive. That means you're going to actually, expel, sputum and all those things, and you feel sore throat and all those things. COVID-19 patients usually get very dry cough. There is no sputum will come out. So this is how you can differentiate between the, two types of problem. Number two, high grade fever. It should be more than 100-degree fever, and continuous fever. Even if you are taking Tylenol, once the Tylenol effect goes down, the fever will come back again. So this is also very important, actually, one of the sign that patient should actually have a very high grade fever. And the third actually symptom is very important, and that is actually breathlessness, shortness of breath. So these are the three major symptoms that can actually differentiate COVID-19 or corona disease from any other similar type of respiratory problems.
Let me
So
translate
we
that. Let
need,
me catch up. Let me translate this because what you just gave us it's very important information. Damas y caballeros, el doctor acaba de decir lo siguiente. Los tres típicos manifestaciones del coronavirus son importantes que ustedes las sepan. Esto es del doctor que nos está diciendo esto. La primera es una tos seca. Generalmente cuando tú tienes un resfriado o tienes el flu, tú tienes una tos productiva que hace de que te salga los excrementos que tienes en la boca. En este caso es una tos seca en lo del coronavirus. La segunda es una fiebre alta, generalmente de más de 100 grados. Y aunque tú te tomes el Tylenol, inmediatamente que después se termine el efecto del Tylenol, la fiebre te sigue. Y la tercera, que es la más importante, es sentirse corto de aire. O sea, sentirse que te está respirando, pero que no te produce el efecto normal que te da el aire. Esos son los tres síntomas clásicos del coronavirus. Go ahead, doctor.
okay. The second thing is that just in case if you are having symptoms and you are not sure, the best actually advice is to quarantine yourself in a separate room within the house, in a separate room, and just watch yourself. If your symptoms actually don't go up, to that level what I just explained, then there is a possibility that in the next couple of days your symptoms will be get better. But in order to actually make sure that you are not transferring this problem to other family member, it's a good idea that you yourself or any member you see are having this mild symptom should be actually isolated in a separate room. But if you are actually there is no symptoms, if you are completely healthy, you don't have any problem, then the entire family can just stay home. Because once you are actually going outside, you're gonna touch your something, other people maybe shake hands, and there is a chance that even the other person is completely healthy, look like healthy, but he may be a carrier, and he can actually transfer coronavirus to you. And if you are actually one of those high risk patient, like the young children and the patient with more than 60 years old, their immune system is very weak, and they can actually get this disease actually very quickly, and they can be become very seriously sick. The other thing is actually the general preventive instruction that you should actually wash your hands with soap and warm water for at least 20 seconds. You should actually try not to touch anything unnecessary. If you are having problem or symptoms, instead of using the clothes, use the napkins, the disposable napkins. So do those actually general hygienic things. Try to actually get shower frequently, wash your hands, wash your body, and stay away from those people who are you think that having some symptoms. So these are actually some very
Okay, so
general.
doctor, I want to ask you a question, which is extremely important right now. A lot of folks are concerned just when they start coughing, right? So, talk about cough, right? Whether it's dry or whether it's productive. It's a dry cough. It is allergy season. It rained yesterday, so now it's a nice day. So, what happens to the pollen count? It goes up. So, the dry cough, is it a persistent, constant dry cough, or is it a you're up moving around and the cough stops, but then at night when you go to sleep, then the cough doesn't let you sleep? But how do you mitigate that and be
Yeah.
able to identify what it is?
Yeah. So, for example, if a patient actually just have one symptom, like you just actually mentioned, the patient actually has a dry cough, it's very difficult to differentiate this patient from the patient who is usually get in this season regular allergies, pollen allergies, or substance allergy or food allergies. My actually advice to all these people is that when you actually get dry cough, you should initially actually consider yourself that this may be due to the coronavirus, because right now it's a pandemic, and there is a possibility that this patient actually maybe getting this problem because of the corona. Otherwise we can rule out. Now we cannot actually rule out just because of the dry cough. So I think the best idea is that this patient should actually isolate himself for a few days. If the dry cough is actually getting better because of the Tylenol or anti-allergic medications, that means this is not a coronavirus. This is not corona related dry cough, because corona related dry cough will not actually settle down because of the anti-allergic medication. Number two is that this dry cough will actually lead to the high grade fever, and then will lead to the breathlessness. So there will be a kind of progression of the disease and the progressions of the symptoms. So if you have actually having this problem, I think your first impression should be that this may be due to the coronavirus. Otherwise we can actually rule out, and I just mentioned how to rule out.
So what I
Very
suggest,
good.
Luis, what I suggest, if you could brief, doctor could brief that how this system will work to help the Latino community and community in large, that how our system, our collaboration is working, that will be more helpful.
Yes,
That how.
yes. So what I did now is, with the audience that's listening to us, is what I did now is I gave them the knowledge from a doctor's perspective, and now we're going to move on to how we're going to help them, because it's the key component there, right? People understand the symptoms, people understand what to look for, and they go through this process. So now they're saying, okay, doctor, thank you so much for getting on Facebook, and thank you so much for distributing this general information. So how can I get help? And this is where it begins. Damas y caballeros, en este momento ya el doctor habló acerca de los síntomas clásicos de lo que puede ser el coronavirus. Ahora vamos a pasar a lo que estamos trabajando con ellos. A partir de hoy, vamos a dar un número de teléfono, por el momento, solo para personas que tienen la capacidad de hablar inglés o de tener un traductor a la par de ellos, pero estamos trabajando en un horario para tener una persona latina a la par de eso, para que conteste los teléfonos en español para las personas que no tienen eso. En las próximas 24 horas vamos a hacer ese trabajo más sólido, porque es difícil poner a cualquier persona. Tenemos que tener una persona que tenga la capacidad médica, y aunque tenemos miembros que están en eso, tenemos 3 miembros de Empowering Young Professionals que tienen esa capacidad. Nos hemos contactado con una de ellos, pero estamos tratando de ver que los horarios sean capacitados y que ella tenga la capacidad de estar ahí al pie del cañón. So, doctor, can you explain to us the process that you guys have set up to help anyone, whether they're here legally or not, whether they have insurance or don't have insurance? There is no cost whatsoever to what you're doing. It's coming out of the kindness of your professionalism and your heart and your personal mandate that you help a human being save his own life. You're helping, mankind. So from that perspective, please let us know what you're doing.
Yeah. So I'm going to ask Brother Jamal actually to start the process, and I will help him to complete the process.
Yeah. So actually, this is what happened. Actually, ICNA Relief, which is a relief organization, and we do relief without any color, religion, race. Whoever call us, whoever come to our table, we help them, right? So we decided to help in this situation while we are distributing food and other stuff. We decided to make a partnership with APPNA, the physicians of those who are in North America, and especially in New York. We partner with them, and we reach out to Dr. Arif, who is the president of APPNA New York. So what we decided, we design a flyer, okay, and there is a link in there, and people, they can go, anybody who can go to that link and fill up. Suppose now people, they are coughing and they don't know what to do. They don't know whether this is corona or this is not corona. If they go to the hospital, they have to sit for 5-6 hours, right, waiting. Okay, so they don't want to go to the hospital. Moreover, it is not safe. They go to the hospital, everybody beside them, they are coughing and sneezing, and they don't have corona, but they will pick corona from there. So why they are scared? So while they are sitting home, how can they get this this information that whether what they are suffering, this is corona or not. So that is why we decided. So there is a link. They can go and fill up this form. It's very easy. 1, 2, 3, 4, 5, and this link is connected to our Google Doc. It direct come to our Google Doc. In the evening, the doctors, those who are free, they will just open the Google Doc. They will see the name, phone number, email, whatever, and they will call the patient, and they will talk to them one to one. This is one process,
Okay,
right?
okay, stop right there. Let me catch up with you on the Spanish. Señoras y señores, esto es lo que hemos logrado con esta organización que se llama ICNA. Esta organización junto con la Asociación de Doctores Pakistaníes, junto con doctores bilingües que hablan español, hemos puesto un website que lo vamos a poner inmediatamente después de esto, pero lo vamos a decir ya. En este website, si usted cree que tiene los síntomas del coronavirus, en vez de irse a un hospital donde lo van a atender 6 horas después, donde usted se va a exponer a que si no lo tiene, otro lo contagie, usted puede meterse a esta página web, llenar 5 preguntas, poner su nombre, dirección, número de teléfono, 5 preguntas. Eso se ingresa a esta red de comunicación y más tarde un doctor lo ve y le llama si los síntomas que usted tiene son síntomas clásicos de los que habíamos mencionado anteriormente. Esto es completamente gratis. So, doctor, I caught up everybody with what you said. The system right now doesn't have the bilingual capacity. You guys and us, we're working on getting that. And by the way, we will get that training. We will identify the individuals and then get them trained. Although they have the medical background, we just want to make sure that they get trained on what you're looking for so that they can understand to weed folks out who don't have that classic trait of coronavirus. And so can you please tell us 2 components to this, right? The first one is, what is the turnaround time? And then the second part is, you see you hear back from the doctor, and is the doctor capable of, number 1, assessing you over the phone, and number 2, if there is a need for medication, prescribe medication to you?
So we will actually try to answer on the same day. So for example, if somebody call in the morning or in the afternoon, we will actually try to assign one physician on that day. And but I just wanted to make sure that we will actually transfer only those patients' information who we will think that they are actually, most probably having corona related those 3 symptoms.
Yes.
That doctor will be bilingual, and they will actually, we provide them the patient's information and patient's complaint. The doctor will then call that person, whatever is the contact number, and they will actually explain one more time, actually, talk to the patients and try to actually assess the patient's complaint to make a decision about whether this patient can be treated at home, or this patient should actually go and try to go to the hospital. All the mild and moderate symptoms can be treated at home, and the doctor will actually advise him. But if he thinks that the patient is actually having now, shortness of breath, and he needed oxygen or he need ventilators, then the doctor will ask him or her, to go to the nearby hospital, because this cannot be actually treated at home. As far as the questions about whether the doctor can prescribe the medication, this is where actually we have limitations, because these doctors actually, since cannot see the patient physically and they don't actually have all the information, so they will not be able actually to prescribe the medication. They will actually ask the patient to go to their primary care physicians, and then these actually, patients should get the prescription from their primary care physician. So we have actually kind of limited authority to guide the patients over the phone or over the email or things like that.
All right. So what is the website the website address for this,
Brother Jamal?
Yeah, so 2 things I tell you. So one is, of course, we will share the form, and it is already available in our ICNA Relief. You have it. I think Kevin have it. He will give you.
I just put it in the chat.
Okay. So this is number 1. But most of the people, maybe they can't fill the form. Maybe they are old enough or they are sick and they can't fill the form. Then we have a number also. If you see the form, if you see the flyer, there is a number 607-232-8708. So there will be somebody always pick up this number from 10 to 6, inshallah. He'll be there physically. He's a doctor himself, and he will pick and he will screen out and he will see what is his symptoms. Suppose somebody come to you with a lung problem or heart problem. So now this time APPNA is not entertaining them. This is done and this is been given only for this corona problem they will handle. So now you have it. I think brother Luis, you have that form, right? So you have
Yes. So,
number and everything.
ahora les voy a decir lo siguiente. Damas y caballeros, en este momento, si ustedes quieren llamar a este número, ustedes pueden llamar al 607. Kevin, put it up on the screen if you can, please. 607-232-8708. Una vez más, 607-232-8708. Ustedes llaman, ahí está un doctor. El doctor va a tomar la información y ese doctor va a ponerlo, la información suya, si pasa al segundo punto, que es si tiene clásicos síntomas del coronavirus, para que un doctor le llame lo más pronto posible. El número de teléfono es 607-232-8708. Esto es para las personas que hablan inglés o que tienen un traductor a la par. Lo pueden hacer ya. Las personas que no hablan inglés, estamos trabajando en que la persona que conteste tenga la capacidad bilingüe. Eso lo vamos a comenzar a hacer probablemente a partir de mañana o pasado, cuando ya identifiquemos y entrenemos a la persona. Tenemos a 3 miembros de Empowering Young Professionals que tienen esa capacidad. Lo único que requiere una infraestructura, no solo la computadora, no solo el teléfono, sino también asegurarse que los doctores lo entrenen a la persona. Así que ahí está la información. Pueden llamar al 607-232-8708. I see it there. There you go, Kevin. Very good. Kevin, ¿cómo estás? Did you take the Sprite and the Vapor Rub?
Did not.
Muy bien. Entonces,
one more
so
thing.
now I caught up with that information. Go ahead.
Yes, one more thing I want to use this one more services we are giving through APPNA, that telemedicine and telecounseling. Some people now in this stage, they are suffering from, anxiety and their other psycho problems, because of their staying home and there is a lot of things going on. So APPNA group, they have a few doctors on board, and if they are going through some mental stress and they need a counseling one-to-one, this is also APPNA they are providing, inshallah.
And do you have that capacity bilingual, doctor, or you don't yet?
At this time, I don't have, but we are looking for somebody. If you guys also can help and to get us on board somebody, it will be a great help.
Okay, great. Bueno, señoras y señores, for those of you who speak English, who are bilingual and have emotional stress, well, I think that's the best way to say it, the emotional stress, and you feel that you need to speak to somebody, you can call that same number?
You can call the same number,
Yes.
and the doctor sitting there, he will just write down in the notes that what type of need he have, and then we will, the same doctor which is connected to, he'll call in the evening and he will find out and he'll talk to him.
So
Very good,
Luis, I
very
just
good.
wanted
This
to
is
add one
good.
more comment, that just in case if that patient actually speak only Spanish, but any family member who is bilingual
I said that.
and who can actually help that person's complaint and fill out the form, and then when the doctor actually called them in English, that family member actually then translate to the patient, that
Yeah.
what is
So
the doctor is
to
actually
expedite
advising.
the process. So
Exactly.
cuando, damas y caballeros, el doctor ha hecho una cosa muy importante. Si ustedes llaman a este número y tienen a alguien que les pueda traducir, llamen ya. Díganle a la persona que les contesta en inglés, obviamente, de que ustedes tienen estos síntomas. Esa persona les va a decir, y después cuando le llame el doctor, vamos a asegurarnos que le llame un doctor en español, y si no, le llama el doctor en español a las personas para agilizar esto rápido, porque yo me imagino que las llamadas van a ser muchas. Recuérdese de que usted puede tener a esa persona que le traduzca, pero usted va a tener un doctor al otro lado del teléfono. O sea, es importante que usted sepa que esto es completamente gratis. Este es un gran trabajo que ha hecho nuestro hermano, nuestro socio Kevin Shaquille, aunque él esté en su casa completamente enfermo, cuidando a su familia. Él está trabajando por nuestra comunidad. Kevin, muchas gracias por lo que estás haciendo por nuestra gente. Yo sé de que es tu gente, tú eres uruguayo y pakistaní, y para nosotros pues es un gran placer de tenerte en nuestro equipo. Eres miembro de Empowering Young Professionals, eres uno de mis socios en America's Islamic Radio, y para mí pues es un placer. Doctor, we are going to overwhelm that hotline. I'm letting you know right now. Our people are going to call, that is a great thing that you guys are giving us in this partnership that we have. We started working in Puerto Rico together, and I didn't think that this was ever going to happen. And now, instead of being in Puerto Rico, we are here helping Americans stateside. Same thing that we were doing in Puerto Rico. Now we're doing it at a mass level, which is amazing to be in this position. And God puts people in the right place. I got to tell you that. Listen, you are a Muslim, I'm a Roman Catholic, and we're working together. This is the way life should be.
We are all human beings, Lewis. Okay, we are all human beings from the same God. So one thing only
That's
I
right.
will request through you, Luis, if you let everybody know that please only those patients call those who think they are corona affected only.
Yes, let me say that.
Yeah.
Let me say that right now.
Yeah, one more thing, Luis.
si usted,
Before you say something,
right.
I wanted to add one more thing. That make sure that you train those volunteers who's gonna actually take the initial calls. That they should also understand that they can actually filter out all the non-COVID patients, and very friendly, politely just explain them that this actually help is only for this crisis, only for those patients who are having corona related disease.
Yeah, we're gonna try to see if we can challenge Kevin so he can perfect his español a little
Yeah,
bit more. We're gonna put Kevin on the hotline also.
it will be tough, I tell you.
Yes. Ahora les voy a decir lo siguiente, mi gente. Cuando llamen a este número, quiero que le den prioridad a las personas que tengan los síntomas clásicos del virus corona. Esos 3 síntomas son tos seca, adicionalmente una fiebre alta que inmediatamente después de que se le terminan los efectos de la Tylenol le vuelve. Y la tercera es las personas que tienen demasiada ansiedad porque se sienten que están cortos de aire. Esos son los 3 síntomas clásicos del coronavirus. Eso no lo digo yo, lo dice el doctor. Basado a ello, por favor, si van a llamar a la línea, llamen a esa línea con una persona en este momento que es bilingüe para que así les pueda traducir. Queremos activar esto lo más pronto posible. Lo estamos activando ya. Es completamente gratis. Es puesto para nuestra gente, asegurándonos de que ustedes tengan acceso sin que se vayan a exponer a un sala de emergencia donde si ustedes no tienen el coronavirus, alguien se los puede pegar, y aparte de eso esperar 6 horas para que después les digan que se vayan a sus casas. Esto es un proceso bien simple. Si tienes esos síntomas, pues obviamente un doctor los va a poder reconocer y te va a decir qué es lo que tienes que hacer. Pero si no los tienes, entonces no te preocupes. Es básicamente, puede ser alergia, puede ser un resfriado, puede ser una tos seca por la temporada que estamos. Tenemos que entender de que nosotros tenemos la capacidad de ayudarnos en casa. Inclusive, muchas de las personas que tienen el coronavirus están pasando la cuarentena en su casa. Eso es todo. Entonces, pero tenemos que entender, si ven los números, and I'm going to talk about the numbers now, because I don't want people to think that coronavirus automatically means dead, right? And that is an important thing. In our ethnic communities, en las comunidades étnicas, muchas veces uno piensa que la enfermedad es muerte. So I want to talk about the numbers. When I looked at the numbers today, we're looking at the high number of infected and the low number of deaths, which we don't want anybody to die, but the number is relatively low to the number of infected. Entonces, señoras y señores, yo quiero que ustedes sepan lo siguiente. El doctor va a explicar acerca de los números. Hay bastantes contagiados,
Kevin,
pero solo hay pocos que se han muerto. Go ahead, doctor.
Yeah, can I just actually give you the number, a kind of a rough estimate? It's not accurate.
Yes.
But 95% of the patients having symptoms, they are actually having mild and moderate symptoms. They will be fine. They will, they can be treated with a Tylenol and, stay home, take care of themselves, take cold medications and all those things. They will be fine 95%. Out of the 5%.
Let me translate that part. El 95% de las personas que adquieran el coronavirus van a estar bien estando en casa y tomando Tylenol y tomando todo lo que tiene que ver con batallar esa enfermedad. El 95% de las personas van a tener eso. Go ahead, doctor.
So out of the rest of the 5%, again, the 4% actually patient will go to the hospital and they will be recovered. Only that 1% who are actually old age with associated other medical problem like diabetes, cardiac diseases, or any chronic problem, right, like kidney diseases in those patients, or old actually, respiratory problem like asthma or COPD or things like that. Only those 1% patient population has a risk that they might actually, will not survive. They will die.
I'm that
So
one.
you can
Doctor,
imagine
I want to talk about
95%.
yeah.
Yeah, go ahead.
I want to talk about thanks, Kevin. There you go, Kevin. So, Kevin, the vapor rub and the Sprite is not going to work for you. So, anyhow, let me say this to you, doctor, which is very important that I'm going to ask because you mentioned diabetes, right? So, diabetes is a very prevalent disease, chronic disease in our communities, right? So, is it uncontrolled diabetes or diabetes in general? Because we have a lot of folks that are not taking care of their diabetes, but we also have a lot of folks who are taking care of their diabetes. So I want to
Yeah.
make sure that people don't correlate that being a diabetic automatically means that if you get the disease, you die.
No, no. If your diabetes is under control, if you are actually, using your medication, you are, your diet compliance, you are doing exercise, you don't have any additional risk. Only those people who are old age, above 60 years of age, they have multiple problems, they have uncontrolled diabetes. Only those patients actually have a high risk.
Ok,
So this is
es
very
importante,
clear,
damas y caballeros, que ustedes sepan lo siguiente. Después de que el 95% está bien, todavía quedan 5%. De ese 5%, 4% van a ir al hospital y van a recuperarse. Después de eso, solo 1% de las personas, específicamente las personas que tienen diabetes que no la pueden controlar, presión alta, problemas respiratorios, problemas del corazón, esas personas son las que están más a riesgo de ser parte del 1% que se ha muerto. En la mayoría de casos que ustedes han escuchado las muertes, siempre hay alguna situación detrás que les ha puesto en esta situación muy incómoda. Una persona que murió que yo conozco, esa persona tenía asma. Entonces, basado a eso, esa persona no pudo sobrevivir el coronavirus. Para que ustedes vean que esa persona era parte del 1% que está a riesgo. Eso es algo muy importante que ustedes lo pueden ver. No lo estoy diciendo yo, lo está diciendo un doctor que está en las líneas batallando esto. So go ahead, doctor.
So that's about it. This is what actually I just told you, that please try to actually lower their fear, that it's not like, that God forbid everyone will be actually, go to that very sick level. 95% will be fine. 95% of the patient who's going to get the coronavirus will be fine. They will get only mild symptoms. Out of the 5%, 4% will again recover. Maybe they will stay in the hospital for a couple of days, but they will recover. Only the 1% patient population has the risk that they might actually, will not survive.
Ok. Very good. Señoras y señores, como dice el doctor, lo vuelvo a reiterar, solo el 95% de la mayoría de personas van a estar bien. Pueden inclusive batallar esto en su casa. Es el 5% y de ese 5%, el 1% que corren el riesgo de morir. Y eso es lo que hemos estado viendo a nivel nacional, hemos lo que estado viendo en Italia, it is the same consistency que vimos en China. Entonces, it is the same thing. Ya aprendimos lo que pasó en China, lo que pasó en Corea, lo que pasó en Italia, lo que está pasando en Inglaterra y ahora lo que está pasando en Nueva York es parte de eso. Usted puede contribuir en minimizar esa ola haciéndolo de esta forma, quedándose en casa, stay at home, shelter in place. If you feel the symptoms, cuarentena en su cuarto, aíslese de su familia, máscaras, ok, yo tengo máscaras por toda parte de la casa, máscaras, ok, lavarse las manos. Tenemos acá esto, I got everything here, doctor, whatever you need, I got, all right, so de todas maneras quiero agradecerle, this is the Phil Ramos, I'm always plugging in Phil Ramos, Assemblyman Ramos gave me this, right, so he's helping my family with this, so I thank you so much. ¿Qué más? Doctor, thank you. On behalf of the Latino people on Long Island and anywhere throughout the state, on behalf of my family, on behalf of all the people that are helping, I want to thank ICNA Relief. And I know that I already had thanked you guys in the work that we did in Puerto Rico. But I want to also thank APPNA. I am not a Muslim brother. Yo soy católico romano. yo no soy musulmán, but you are no different than me. And the one beautiful thing that your religion has that I wish that everybody understood, which is very important to me, is in the Quran, there is a verse that says that if you help save one human life, you help save humanity.
Yep.
And
Exactly.
inshallah,
Amen.
we're going
Yep.
to do this to a lot of people.
Yeah. So in the end, before we conclude, Kevin will conclude, inshallah. So I just want to let you know that being in ICNA Relief, ICNA Islamic Circle of North America Relief, our mission is to alleviate a human suffering while maintaining their dignity, and strive to build healthy community. And our vision is to become the charity of choice for all Americans. Today, this evening at 5 o'clock, we have a telethon. If Brother Kevin, if you can just let people know and conclude, inshallah.
We definitely will share, Doctor. I got the message from you. We're going to put the link on the bottom as well with the picture. So if you guys want to participate in the telethon, you can definitely reach out, and the image has how you guys can participate as well. So thank you guys so much for
Kevin,
joining us.
hold on, Kevin. Did we get a donation of rice coming
Yes.
from
So
tomorrow?
so basically, we have 200 pounds of rice coming from ICNA Relief tomorrow. Shamala is setting it up. So Brother Arsha as well. Thank you so much.
Thank you.
Okay, no problem.
Thank you. Thank you for your help.
Thank you guys so much.
Thank you. And Kevin,
Yeah.
can we stay on live so this is where we can recap and explain everything?
For sure.
So
Sure.
today,
Thank you, Doctor.
if anybody wants to join today from 5 to 7, there will be a telethon fundraising for ICNA Relief. Inshallah, you can go to our Facebook, ICNA Relief Facebook, and you can join and you can see and you can participate, all of you. I invite all of you there.
Thank you guys so
Thank you
much.
very much.
Dr. Brother Jamal, thank you guys
Thank
so
you.
much. Thank you for joining, taking the time.
Thank you.
Allah Hafiz.
I appreciate it. Thank you. Allah
Bye-bye.
Hafiz.
Khuda Hafiz. Allah Hafiz.
Well, we're now here, Kevin. I want to say to you, thank you. Thank you so much. Muchas gracias, Kevin. Nuestra comunidad te va a bendecir a ti y obviamente las bendiciones de Dios para nosotros y para todos los que están ayudando. Quiero recalcar lo siguiente. El esfuerzo de comida que estamos haciendo es gracias a todos los valientes. Yesterday, I put the pictures. I don't know if you saw that post. The pictures of all the people involved in doing the food effort, right?
That was a
And
great
it's
thing,
amazing.
acknowledging everybody. And we're not, they're the heroes. They're the ones who are working out there, who are picking up the groceries, dropping it off. They're the real heroes. So thank you guys, everybody who's been helping out our team for this effort. Thank you. You guys are the real heroes, not us. You.
Yeah. I mean, nosotros somos herramientas. So, quiero decirle a mi comunidad de que es importante que ustedes sepan de que esta organización Empowering Young Professionals la creamos hace 1 año y medio atrás y la creamos tratando de llenar ese espacio de falta de liderazgo que hay en la comunidad, porque nosotros en nuestra comunidad latina no tenemos líderes de verdad. Ellos se autonombran solo porque tienen tal vez una capacidad mínima de tener influencia sobre la comunidad. Entonces, mi meta era asegurarme que todos estos jóvenes, Kevin, que tiene 26 años, Jorge Guzmán, que tiene 28, Katy Herrera, que tiene 34, Gabriela Guzmán, que tiene 32, estos líderes del futuro, mi hija, que tiene 20. Entonces, todos estos líderes del futuro que se vayan formando en una buena forma, en una forma ética, en una forma moral, en una forma comunitaria, donde el egocentrismo inmigrante que tenemos nosotros, que tú eres mejor que yo soy mejor que tú, que eso no exista. ¿Por qué? Porque de la única forma que vamos a ayudar a la comunidad es uniéndola. Esa es de la única forma que lo vamos a hacer. No lo podemos hacer sin unir a la comunidad. Y basado a eso, se han dado cuenta que el trabajo que estamos haciendo de trabajar con Romeo Lepe, que es un excelente guatemalteco, y déjeme decirle algo muy importante, desde hoy en adelante la comunidad centroamericana, específicamente mi comunidad salvadoreña, tiene que entender de que detrás de todo este esfuerzo hay un guatemalteco que se está fajando como que si él fuera salvadoreño y orgullosamente guatemalteco. Cuando hay otros guatemaltecos de que tienen hasta páginas de 100,000 personas que no han pedido ni un frijol para nuestra gente, ni un frijol, mucho menos una libra. Entonces, Romeo, muchísimas gracias en nombre de mi gente salvadoreña. Te lo agradezco mucho infinitamente. Quiero agradecerle también a las más de 32 personas que tenemos nosotros. Tenemos a Luis Salamanca, a Paco Vanegas, a Víctor Pacheco, tenemos a Giovanni Fernández, tenemos a Pablo Lazo y el equipo que anda manejando, a DJ Mike, tenemos a DJ Cali, tenemos a Lorena Valdés, tenemos a Rubén Valdés, a Yocasta Riaza, a Ceci Martínez, a Carolina Alfaro, a Patti Morales, a toda la gente de caricaturas, de Fundación Caricaturas, Todos ellos, todos los que nos están ayudando, todos, desde Roberto Rivas, que siempre anda tomándose el riesgo junto con DJ Mike, Romeo Lepe y mi persona, comprando en las tiendas, expuestos a este coronavirus, hasta las personas que están empacando esto en nuestros estudios, hasta las personas que lo van a dejar directamente a la casa de las personas necesitadas. Yo les quiero dejar con un mensaje que recibí ayer de una joven madre salvadoreña. Me pidió en un mensaje bien largo y bien explícito de que ella quería ayudarnos a cambio de ayuda. O sea, quería andar dejando cosas a cambio de ayuda. Fuimos a dejarle lo que ella necesitaba. Y cuando llegamos ahí, ella se ofreció a ayudar. Pero había dejado la puerta abierta y salieron sus niños. Y al ver los niños, yo le dije lo siguiente: tú eres la madre, es madre soltera. Entonces yo le dije, tú eres la proveedora de tu familia. No puedo en inconsciencia mía dejarte de que andes exponiéndote. Aquí está tu ayuda, toma incondicionalmente y estamos para servirte. Eso es lo que estamos haciendo. Que no se les olvide a ustedes de que estas personas que están ayudando, más de 30 personas, se están exponiendo todos los días en nombre de la comunidad. Y que Dios nos bendiga a todos. Porque hasta este momento, gracias a Dios, todos estamos bien de salud. ¿Será porque Dios nos está guiando? ¿Será porque nos da la fuerza? Y hasta este momento, aunque no podemos ayudar a todos, Dios nos ha dado el material para poder proveerle a la gente lo básico. Kevin, I once again thank you so much. I know that you're home. I know that you're frustrated that you cannot be out there with me, right? Out there with us. But
Feel
I know that you're
sidelined, man.
doing...
Feel sidelined. Feel like the stepchild.
Yeah, I know. And so everybody saw your video yesterday. Y lo que yo le dije, and I told some of our members what you had said to me in private. You had said to me that you had reached out to your brother to make sure that if something happens to you and your wife, that your kids, your girls, your beautiful girls, your household is bright right now because of your girls, have the ability to be taken care of by your brother. That,
Yep.
my friend, is tough.
Yep.
That's tough. Entonces, señoras y señores, yo le quiero agradecer a todos ustedes. No se olviden. Please keep the number for ICNA. Put it up there, right? Ese es el número a llamar. Ahí está. Ese es el hotline. Marquen ese número, por favor. Pongan ese número. Márquenlo. Y cuando lo marquen, recuérdense que necesitan a una persona bilingüe por el momento. Pero estamos trabajando para que sea una persona que les hable en español directamente. Después les va a llamar un doctor y ese doctor va a conversar con ustedes acerca de tus síntomas. Esto es suficientemente grandísimo, Kevin, para nuestra comunidad. Esto es grande. Para comunidad indocumentada, esto es grandísimo. Que Dios te bendiga, que Dios nos bendiga a todos. Muchas gracias. Anything you want to say, Kev?
Nope, at all. If you guys need help, reach out to us. We're here to help.
All right, Kevin, no more vapor rub.
No more vapor rub. Thank you, Lou, for joining us. Seriously, the translation's needed. My Spanish is not that great, but thank you so much, bro.
You got it. Take care.
To our viewers, assalamu alaikum.